But as we look at it, coming out of this, a lot of habits have changed, right? We've experienced, not only from the patient perspective, but from the physician perspective, we've all experienced sort of a taste of what digital healthcare could look like in the future. Some of us have done some experiments with remote patient monitoring and those kind of things. What does, based on what we've learned, what does the future of healthcare look like?
So it's interesting. Even if I go today, we encourage our clinicians and our clinics to try to do as much telemedicine as possible. Encourage folks to not come in until we really have subsided from this pandemic. But we're still seeing a 60-40 split, where 60% of our patients prefer to come in person. And if you look at which clinics predominantly people are very comfortable doing telemedicine, you look at psychiatric support, mental health support, mental wellness, all these types of primary care. These are the kinds of clinics that people absolutely want the on-demand. Let's do a quick, hey, I feel X, Y, and Z. I need assistance with this. My ear hurts. What do you think, doc? Those kinds of things people want instant access to on their time. What's going on for folks in a specialized clinic, like let's say women's health or others? They much prefer to come in and have a private, in-person conversation, and I can appreciate that. I can understand the nature of that. So, in my belief, the healthcare experience of tomorrow is a hybrid model where the majority of your primary care and conditions, like I just mentioned to you, are telemedicine primarily, and which allows better access for those needs, because obviously there's a tremendous demand. And your specialized clinics have got to go to the home, whether it's wellness clinics, a women's health clinic, or whatever, at someone's home, whatever else. It can't always be come to my location. I'm in downtown Austin. It's not fun driving around the city that has all one-way streets and wasn't designed for this types of traffic, right? It's kind of like driving in Boston, like, oh my goodness. But if we can extend those types and capabilities to the home, that's where rubber meets the road. Now, what's holding us back? I give a lot of credit to the FDA. Over the past couple of years, they have accelerated approval of various digital therapeutics and home monitoring solutions that give the type of telemetry of data necessary for clinicians is to confidently sit behind a computer and say, yep, Aaron, I can see that your vitals are this. I can see your O2 rate is this. I can see that your glucose level is this. Here's what we need to do for you. Go get this medication. And by the way, now I just saw that Uber's partnering with like SureScripts or someone to deliver prescriptions to you. So maybe I'll send an Uber to you with your prescription, right? Something like that is what's coming down the pipe. But it's going to take technology. It's going to take a willingness from the healthcare community. And last but not least, it's going to take reimbursement, where I do feel that now our officials and others are listening and seeing that this actually saves a lot of money. In addition to the right thing for the patient, it saves a tremendous amount of money to the overall cost of care, which has got to go the other direction. It's just too expensive these days.